Welcome back. We are answering your questions about the coronavirus with Cone Health's Director of Pharmacy and Oncology, Dr. Andre Harvin. Remember, you can text your questions. Really quickly, this person is saying, is there anything specific I need to bring with me when I get my vaccine in Guilford County, and how much earlier should I arrive than my appointment?
Yeah, the biggest thing you want to make sure you bring is your driver's license. And then if you have any healthcare cards, like your insurance card, just bring that as well to make sure you have all that information. And then you really only want to arrive about 10 to 15 minutes beforehand.
All right, this person says, what can or should you do if you're unable to make a second appointment?
We would ask that you please give us a call to let us know that you need to cancel the appointment. Now, it is very important that you take that vaccine on schedule. So you want to make sure you get to that 21 days or the 28 days, depending on which vaccine you receive. So if you're unable to make it, make sure you call back in.
Okay. And after getting the COVID-19 vaccine, do you still have to quarantine if you're exposed to the virus?
So for the most part, what we're seeing right now is no, you won't have to do an active quarantine. Now, you want to make sure that you connect with your place of employment to make sure that they agree with those recommendations. Right now, if you're fully vaccinated and you come into contact with someone that's positive, as we all likely have at some point in time, they're not recommending a full quarantine anymore.
This person is asking, when you go to get your shot, can you request Pfizer or Moderna?
Right now, you cannot. It depends on what the clinic has available. So we're receiving different allocations of different vaccines. They're both highly effective. There's really no difference between the two. And so either one, if it was available to me, I would take it.
Okay. And this is kind of like a 3-in-1. So should people with heart problems, someone who's getting chemo, someone who's pregnant, should those people be getting the vaccine?
Yeah, right now we still recommend the COVID vaccine for all persons that are eligible for it at this point in time. Really, you want to have a good conversation with your doctor, whether it's your cardiologist, your OBGYN, or your oncologist, to make sure where you are at that point in time is a good time for you to take it. Again, for our patients right now in oncology or cancer care at Cone Health, we are recommending the vaccine for them. Unless they're just at specific points in time in their chemotherapy treatment, we may recommend them to hold or pause for a period of time. So make sure you check with your caregiver, and they'll make sure that you know whether or not you should get it.
This person is asking, if you already had COVID, do you still need to get the vaccine?
Yes, you'll still eventually want to get the vaccine. There are recommendations about if you actually had symptomatic or non-symptomatic COVID. Again, the website can tell you all about that and what that means. But once you've had COVID and you've gotten over it, you will have some natural immunity, but you won't have as strong immunity as you would get from getting the vaccine. So we're still recommending that you get the vaccination, even if you've had COVID.
And just quickly, can the vaccine improve a COVID patient's condition?
If a patient is in the hospital right now with COVID, the vaccine is not known to be able to have any efficacy for those patients whatsoever. We do have other drugs that can help them, but the vaccine is not one of them that they're recommending.
Interesting. Okay, thank you so much for your time. We so appreciate it. We thank you for your questions as well that you have texted in. If you missed any of this, all of this will be on our website, so just look at WFNYnews2.com.